I would like to start saying that allergies are very prevalent. Are chronic conditions that affect about 30-40% of the population, but in pediatric age, it can be even higher. One of the our areas of interest here at Cleveland Clinic Abu Dhabi, the Allergy and Immunology Department, is food allergy. And so what do you think, Dr. Hamad, are the most important or prevalent allergies here in the UAE?
Well, from my point of view, like I see that it is similar to that allergen that is like common in European country. But as you know, like sesame is very common in our cuisine, and the prevalence of sesame allergy is very high. Plus, we have also patients who have like the tree nuts, like for example, like the pistachio, cashew is also very common allergen here in UAE. And also, I would say also the common one, like for example, especially in the toddler, like the egg and the milk, these are the common in this specific age group. But I would like to ask a question regarding like the early introduction of food. Is it better to early introduce different allergen at a very early age, early age stage, or should we wait and introduce these allergen food later in life?
That's a very good question. So when I did my training, we used to postpone and we used to tell parents to delay the introduction of allergenic foods. But we've learned recently in the last years that the earlier we introduce the foods, the better. And we have strong evidence for peanut, for egg, and this is probably true for most of the foods. So now the advice is when we start diversifying the food, the diet in babies around the age of 6 months or a bit earlier if the baby is ready, we should introduce all allergenic foods. We shouldn't delay. And this has been linked to reduction in the incidence of allergies.
I agree with you. And one of the main landmark study, which was like the LEAP study, which is learning early about peanut. So when they did this study, they introduced like the peanut in a very early age, and there was significant reduce of the risk of developing peanut allergy in kids.